Well, good afternoon, ladies. We're going to get started. I love the vibe in this room. I love everybody already connecting with each other. It's like we've been in a quarantine or a pandemic for so long we haven't seen each other. It's amazing to see this many people today. Thank you all for coming. My name is Sarah Pearson, and I am the Executive Vice President with the Boca Chamber. It is time to kick off the program, so I have a question. And you guys can't answer, Chastity, Allison, Ryan, Jen. And probably the doctor cannot answer this. She's not allowed. What is the largest organ on a human's body? Skin. Okay, skin. How many pounds of skin generally does an adult carry? 10, 30? What? Shout out a few more numbers. The skin. What? 8. How do you know that, Jennifer? Oh, 80. No. It's 8. 8 pounds of skin. I mean, think about that. And then you know how many square feet of skin is on? I mean, this is stuff that you want to know. 22 square feet of skin on a human's average on a human's body. Listen, this is all fact because I saw it online. But I think our doctor's going to be able to kind of clarify some of that. All right, so it's my privilege to introduce the speaker today. Meredith Han Hancock is a board-certified dermatologist with ClearlyDerm. She is on staff at ClearlyDerm Dermatology in both Central and West Boca Raton. She received her medical degree at Loyola Stritch School of Medicine outside of Chicago, where she stayed to fulfill her internship in internal medicine at Loyola University Medical Center and Hines Veterans Hospital. She then completed her dermatology residency and served as chief resident at the Marshfield Clinic in Marshfield, Wisconsin, known for its comprehensive care, community focus, and research facilities. After graduating, she stayed on as faculty at the Marshfield Clinic Health System, focusing on complex medical dermatology, acute care dermatology, and hospital consults, while teaching dermatology, internal medicine, and pediatric residents in addition to medical students. Extremely busy. She specializes in medical, surgical, and cosmetic dermatology. There's a dermatological coming up, so serving both adults and children. She has a special interest in complex dermatological cases, including autoimmune and inflammatory conditions. She is a diplomat of the American Board of Dermatology, a fellow of the American Academy of Dermatology, a member of the Medical Dermatological Society, Women's Dermatological Society, National Psoriasis Foundation, and American Medical Association. Dr. Hancock and her family moved to Boca Raton from Wisconsin and are enjoying exploring southern Florida. She enjoys languages, which I think is awesome, traveling, cooking, tennis, and spending time with her family and friends. She's fluent in French and proficient in Spanish. So without further ado, Dr. Hancock. Thank you. Thank you.
All right, well, thank you all for thank you all for inviting me here today. I appreciate the opportunity to talk to you all. Okay. So this isn't my talk yet. This was kind of an intro that Mara had put together, but I'm going to do my best to go through the pre-talk. Okay. So in general, ClearlyDerm is where I work, and there's 3 different locations in Boca Raton. We have 2 in Central Boca and 1 in West Boca, near the West Boca Medical Center, and I work in 2 of those locations. Generally, what sets ClearlyDerm apart from the rest of dermatologists, we have same and next day appointments. We have a very high level. Oh, sorry. Can you hear?
No worries. We just can't hear you.
Oh, I'm sorry. Is that?
That's okay. Yeah.
Better? Yes. Okay, sorry about that. Oh, yes, I can hear myself. Okay, so we have a high level of customer service. Management is available. We keep things clean, modern, and accessible. We do Mohs and vein surgery, medical aesthetic treatments. We take most insurances, including Medicare and HMOs. We have complimentary cosmetic consultations with medical visits, and there's monthly cosmetic specials. And then I'm just going to kind of cut this down, but teledermatology is available, and our medical directors have overseen and designed a very robust COVID safety procedure. In fact, this is the first time I've spoken without a mask on. It feels very odd. This is a new thing for me. And then we offer all of these things. In general, acne, skin cancer, definitely the very normal and basic things of dermatology, but I know for myself and many of my colleagues, we will see anything, anyone. And then for cosmetic treatments, very briefly, the general things, fillers and neurotoxins, peels and microneedling, things like that. And now we're offering threads. Here are some of my colleagues, and let's see here. And then these are our 3 locations in Boca. And then she already went through this, so I won't do that again. Okay, so now this is my actual talk. All right, so thank you again for having me. I really appreciate the opportunity to come talk to you all. So I'm going to be talking about cracks, bumps, clumps, and grumps, Skin Health 101 during a pandemic. So I kind of joke about this, but it's kind of true. I'm a mom and a dermatologist, so I feel like I'm not scared to see anything, basically. Okay, so as you all know, we're just over 1 year into the pandemic, and most of us know about the serious consequences of COVID, whether we've experienced it personally or through friends and family. But today I wanted to discuss the changes that everyone has in their daily life and how that affects our skin. And so I'll talk about what you can do at home and at work to prevent and treat some of these now common issues. Okay, so why are these things happening? So generally speaking, we're washing our hands more often, we're wearing masks sometimes for hours on end. I know I am for sure. We all have a lot more stress in our lives. We all have experience with medical issues. Some are expected, some are unexpected. And then basically our screenings and self-care are really being put on the back burner, and we're not taking care of ourselves and our families in the way that we used to. Okay, so the first thing I'm going to talk to you guys about is cracks. Okay, so when I think about cracks, I think about what comes into my office. And so what I see coming into my office a lot is hand dermatitis. Hand dermatitis is a broad term that covers many different types of rashes on the hands. So an irritant contact dermatitis is something that anyone can have. So if we all wash our hands enough, we're all going to get irritated by the soap and by the water, and we're going to end up with dry hands, cracks. An allergic contact dermatitis is more so not everyone will get this, but so one person may have a fragrance allergy or an allergy to neosporin or something like that, where you actually develop an allergy to a product or a chemical. And then, of course, there's also dyshydrotic eczema, which is very common when you overwash your hands and you get little bumps on the sides of the hands. And then normal eczema, which is atopic dermatitis. So I just wanted to show you some examples of the things that I would see in the clinic. So this is just very dry hands from overwashing, possibly. This is also something I commonly see in the clinic, which is just more of a red, irritated rash. Again, could be from just soaps or hot water. And then this would be a more severe case. And this is what happens around the nails. So you could see that the cuticle is actually gone, and this actually puts the person at risk for infection. And then this would be a case of an allergic contact dermatitis, and you can see that the rash is actually extending up onto the forearms. And lastly, this is a case of dyshydrotic eczema. And you probably have experience with this. It's when you overwash your hands and you get little bumps that are really, really itchy on the sides of the fingers. Very, very common. So why are we getting hand dermatitis? So I kind of mentioned already, we're washing our hands more frequently. We're using hot water. We're using harsh soaps, we're using antibacterial soaps. Many people are not rinsing as well as they think they are. We're also using hand sanitizer with and without fragrances, and some are homemade, which is good or bad depending on what you're putting in it. Also, we're using wipes without gloves to clean, and even baby wipes can be very irritating. So what tips can I give you for just basic hand dermatitis? So in general, the first thing, when I see this and people come in, I'm like, no hot water. You got to stop using hot water. Hot water is just, it's not necessary. Warm water is fine. Also, I really advise against antibacterial soaps because it's very irritating, and actually you can develop allergy to some of the antibacterial components. I also recommend only washing hands when necessary. So you really want to limit the wet to dry cycles. Every time you wash your hands, you're actually stripping the natural emollients and oils off of your hands, and it actually dries you out. You also do need to rinse well to avoid soap trapping. So if you wash your hands and you've got soap on your hands, if you don't rinse it well enough, it actually kind of will sink down into the creases of your hands and you'll get a rash in between the web spaces. So, and in general, I actually recommend, if your hands are not severely cracked, I recommend using hand sanitizer more than soap and water in certain cases because it's actually less drying. Now, I understand, you know, when your hands are cracked and use hand sanitizer, it really hurts. So at some points, you do have to just wash your hands. Okay, so what else can you do? After you wash your hands, you need to apply a bland, fragrance-free ointment. Now, an ointment is something that's greasy, so something like Vaseline or something like CeraVe ointment, because it'll hold in the moisture much better. Creams are creamy and white, and they also have more chemicals in them, so they can burn and aren't as pleasant sometimes to put on. You can also wear white cotton gloves or socks on the hands at nighttime, and that'll kind of help keep that moisture in. You also want to make sure that you're wearing gloves when you're doing cleaning, or if you're doing any kind of water work like washing dishes or anything like that. And then this one always surprises people, but whenever I do a biopsy or anyone comes in, I'm like, do not use triple antibiotic ointment, do not use double antibiotic ointment. Really don't need it. The only reason it's helping you is the ointment within it. It's really not the antibiotic. So please don't use it. And then you get an allergy and then you come see me and then okay, so also things to keep in mind. I know everyone likes to be natural and organic, but it doesn't mean that there's no allergens in it. So I just want you to remember that poison ivy is all natural and organic and definitely makes a really big rash. So just keep that in mind. And then lastly, if hands are red and cracked, if they're itchy and painful, you know, at some point, you know, you probably need a prescription topical steroid, and that's when you would come see me in dermatology. This is just an infographic that you can find in the American Academy of Dermatology website, kind of going through what I already spoke about today. Okay, so moving along, we're going to move on to bumps. These are not my photographs, but okay, so maskne. I'm sure all of you have heard about maskne or mask acne. It's a real thing. This is coming from an article from the New York Times. These are just a variety of the different masks I've worn, some at home, some at work. Generally, I don't wear any of that now. I wear just the N95 mask and a face shield, but hopefully soon we can start working away from that as well, but we'll see. All right, so maskne. Again, this is a broad term that covers several different issues. I'm going to focus on peri-oral dermatitis, which is kind of a cousin to rosacea. And then other types of maskne would be acne mechanica, or basically it's when you're wearing a mask or something like a chin strap in school sports where there's an actual physical rubbing. And then contact dermatitis, like I mentioned before with the hands. You can develop either an irritant or an allergic contact dermatitis from the mask or from detergents and different products that are coming into contact with your skin. And of course, you can always have a normal acne flare. So these are just some examples, mostly of peri-oral dermatitis. So you can see a lot of little red bumps around the mouth and nose. This is a child. This is a little more subtle on an adult male. This is a little less subtle. And this is a more severe case. And then something to keep in mind, peri-oral dermatitis actually can happen around the eyes as well, and in that case we call it a periocular dermatitis or a peri-orificial dermatitis. So you can get it around the eyes as well. So tips in general for peri-oral dermatitis or maskne. So first thing you want to try is zero treatment. Now by the time you come to me or another dermatologist, you've probably tried 10 different things on your face, and usually one of them is a topical steroid. And topical steroids actually at first will help a perioral dermatitis, but they actually cause it to flare. So you want to stop any type of topical steroid to the face, so hydrocortisone, a lot of anti-itch creams will have that in there too. You want to do gentle cleansing daily with a fragrance-free cleanser and just warm water. I would avoid face wipes if you can. And then for moisturizing, you want something that's light, fragrance-free, and lotion. In general, you don't really want to wear makeup under the mask if you don't have to, because basically you're just taking that makeup and, kind of pressing it into your skin, and, bacteria and yeast can grow there. Other things to avoid, if you're using retinols or retinoids in the mask area, it can be extra irritating, so it's okay to use in the evening, but you may have to lighten the potency. So other masks, other tips for maskne is make sure that you change your mask daily. You want to wash your cloth masks with gentle detergents and give them an extra rinse. If you do have to reuse your masks, just make sure that you're rotating them. You want to dry them in the sun if you can, or in the open air. And you really want to store them in a paper bag, not plastic. Plastic's going to just keep all that moisture in there, and not a good idea. And then, of course, you want to throw them away if they have an odor or if they become discolored. Now here are some other types of bumps that you can see under the mask. So the first is an allergic contact dermatitis that we spoke about. You can get this from lip balms, lipsticks, dyes on the masks, different fragrances, and generally these actually do need a topical steroid or a non-steroid prescription. Angular cheilitis is more in the creases of the corners of the mouth. Happens a little more commonly as we get older because we get more downturning of the corners of the mouth. And when that happens, yeast can kind of grow in there. And then staph and strep can happen all over the mouth, in the corners of the mouth, and that generally requires a topical or an oral antibiotic. So this is an infographic from the American Academy of Dermatology with basic face mask and skincare, kind of what I already have gone over. And just a note for fragrance-free, I wanted to kind of educate you on what fragrance-free actually means. So fragrance-free means no fragrance is added to the product. Whereas unscented, there actually is a fragrance and then there's a masking scent over top. So you just can't smell the fragrance. So whenever you can, if you're trying to keep things very simple and cleaner, you want to try to choose something that has fragrance-free and not unscented. Okay, so moving along, we'll now talk about clumps. So clumps, to me, in clinic is hair loss. So this is a huge, huge, huge topic. So I can't get into every aspect of hair loss today, but something to know, just alopecia is the medical term for hair loss of any kind. It is normal to lose 100 hairs per day, but just remember, if you're not washing your hair every day and you're washing it every other day, that's 200 hairs every other day. So some people, if you're not washing it as often, you're going to feel like you're losing more hair, but you may not be. Now, it can be caused by many different things, as I mentioned. It can be something related to medical problems such as low iron, low vitamin D, thyroid issues. Some of it's hereditary, some of it's hormonal and normal aging. Certain medications can cause hair loss. And then mostly what I'm going to talk about today is the emotional and physical stress that can cause hair loss and what we're seeing during the pandemic. And of course, different hairstyles and harsh products can also contribute to hair loss. Okay, so the type of hair loss I'm talking about mostly is telogen effluvium, which happens after an illness. So if you've had COVID, if you've had any kind of illness, to be quite honest, that's been severe or even moderate, you can have hair loss. Any kind of fever, surgery, stress from job, family, money, health worries, and then of course postpartum, you also have a telogen effluvium. And this is kind of what people may see. Now this is, you can just see thinning of the hair over the scalp. This is a postpartum telogen effluvium, just thinning of hairs, hair density. And this is on the side of the head. Now this picture is actually showing hair regrowth. So after your hair starts coming back, you get more baby hairs, or vellus hairs we call them. So with telogen effluvium, generally the hair loss occurs about 2 to 3 months after the trigger, and you'll have a noticeable shedding. Now, the hair regrowth usually occurs once the stressor is removed. However, if you do have a chronic stress, that hair loss can be ongoing. So if you know you have a chronic stress with either health issues or money issues or anything like that, you kind of have to keep that in mind, that if we don't get rid of that stress, you can just keep having the hair loss. But generally speaking, it does resolve on its own within 6 to 9 months. So what tips can I give you for telogen effluvium? So some people will use men's strength minoxidil, which is Rogaine, over the counter. You can always take a vitamin D daily. You check with your primary care physician if you're deficient or not. In general, people can take 1 to 2,000 international units daily, but if you're very deficient, you may need more than that. Hair camouflage is basically when you notice hair loss, you're noticing the difference in the color between your hair and your scalp. So if you have dark hair and light scalp, you're going to see that much more clearly than if you have light hair and a light scalp or dark hair and a dark scalp. So hair camouflage, basically you can use powders to kind of mask that difference, or you can choose to wear wigs or hats if it's a significant hair loss. But in general, you want to eat a well-balanced diet, you want to get your rest, try to de-stress, and exercise when you can. If you have a rash with the hair loss or any kind of other irritation, other symptoms, then that's when you come to dermatology and we try to see is there something else going on other than just a stress-related hair loss. Okay, so moving on to grumps. And this is my daughter. She's got a grumpy face every now and then. Okay, so grumps. So we have all these reasons to be kind of grumpy right now. We're all kind of, it's been a year. We're all suffering from COVID fatigue. We're kind of sick of wearing the masks and not seeing people, and we're not seeing our out-of-town family as much. We're seeing our own family more, which could be a good or bad thing depending on the day. Our kids are in and out of school. Their routine is disrupted. Our work and our career has had a lot of ups and downs. We're wondering, is this a new way of living? There's a lot of uncertainty, and we're all wondering, when are things going to get back to normal? Now, what I hear in clinic is, I don't want to look tired. I hear a lot of people are doing a lot of Zoom calls, so we are all seeing ourselves way more than we used to and way more than we ever wanted to. So we're now seeing things that we did not see before. And stress does take a toll, and again, we're not taking time to take care of the basics, so we're kind of neglecting ourselves. Okay, so what tips do I have to kind of avoid the grumps? Okay, so I do want you to go to the doctor. I think a lot of people are really not keeping up to date on their age-appropriate screenings, and so I do think it's including skin cancer screenings for us, people who have history of skin cancer or melanoma. I do want people to come in and see us. And of course, you should be getting your mammogram and anything else that you should be normally getting. I do think that, in the next year or so, we're going to see kind of this backup of people that haven't been diagnosed with things and unfortunately may be a little bit more advanced than we're used to. So it's really important to make sure you're doing your normal health care. I'll just speak for myself, but some of us need to work on losing the COVID 10 or 20 pounds, 5. We should spend more time with or without our family and our friends as we're able to. I'm trying to practice gratitude and be thankful for what I do have, and especially like living in Florida, it's very, very nice. And then just to reconnect with yourself and reflect on everything. Reflect on the last year and hopefully the next year to come. And then you want to enjoy the outdoors. Like I said, we do live in South Florida, so we should take advantage of it. Really appreciate what we have and get out there. Just make sure you're wearing your sunscreen of SPF or higher, 30 or higher. Wear your hat, your sunglasses, your sun protective clothing, but definitely go outside. Do things like tend a garden, even a little herb garden. You can condo your closet, your office, your kitchen, and then you can do a spa day at home. I know this is like mini spa days with my daughter, Amelie, and that's my son. I had to put him in there, he'd get jealous. But he's just doing, beauty sleep. Connor. So, and they're very embarrassed, so. Other things you can do, you can venture out as things are kind of opening up and as people are getting vaccinated and feeling more safe. You can get your hair cut, you can get a manicure, you can get a facial, you can get a massage, and just make sure where you're going has good safety procedures before you go there. And I have to thank all of you because I will say I had to take my own advice because I knew I was going to talk to you about this, and so I had not cut my hair in a year. So there's my hair as of yesterday. Very long and unruly. And then that was yesterday. So, and this is probably the last time it'll be straight, but I thought I would keep it there. So what else can you do? I mean, of course, there's cosmetic treatments, and now is a great time to hide your recovery with a mask because we're still wearing them. But of course, you want to take care to avoid maskne. This is one of my medical assistant's mothers, and we treated her crow's feet. Very simple, but she had a really good response, so I wanted to share that with you. All right, seeing where we are here. So just in conclusion, basically I talked about cracks, which is the hand dermatitis. I talked about bumps, which is the maskne. I talked about clumps, which is hair loss of different kinds. And I talked about grumps and how we should take care of each other and ourselves just so that we stay healthy moving forward. And some of my references, and of course my patients, my friends, my family, my coworkers have all been really great, and they're good references and make me learn every single day. These are my medical assistants, Sam and Jessica, who I think are watching on Facebook. And so they threw me a little birthday party last year. And then this is my family, Amelie, Connor, and David. These are all pre-COVID pictures, unfortunately, but. And I want to thank you for having me. I really appreciate the opportunity to talk to you. Any questions?
All right, who's got questions?
Sorry.
There's got to be questions in this room.
All right.
Well, she went first, but then I'll come over here. Yes.
So, are there any recommendations of just natural skincare? Things that you would recommend? Like I use just like straight aloe a lot, but is there anything like that that's not like over the counter that you?
I know. Sorry.
Recommend for?
So for like dry skin or.
Just for skincare in general, just natural.
So, I mean, aloe, I would say if you're going to use aloe is usually more for wound care or wound healing, but, I would say aloe from a plant is fine. Now, you could always have to keep an eye on, any kind of rashes, because you can get, like I said, you can get allergies to anything. But, aloe, like in a bottle, I'm not so, keen on, because I don't think a lot of it isn't real. But I just like simple things. So if you're someone who doesn't break out and you have very, very dry skin, white petrolatum is, it's cheap and it's easy and it's there's no fragrance, there's almost nothing in it. It's hard to find anything that's completely natural when it comes to like a cream or a lotion. Everything's going to be chemical somewhat, but it just depends on what you're trying to do. So
What's the name of that? White?
Oh, it's Vaseline. Or if you're listening to Jennifer Lopez, I guess olive oil. But yes, go ahead.
Okay, so because of the blackness, I never had blackness ever, but because of the mask, I find that right around the chin area, and I scrub.
I know.
Wash my mask. Is there something else that we can do?
Yeah, yes, definitely. So a couple different things. So you can, right. Well, I will say I also got a hydrofacial before this too, because I was like, I got to do other things to make myself presentable, because I also have that issue with wearing, a heavy duty mask on the chin. Even though I'm not wearing makeup under it, I'm getting, clogged for sure. So hydrofacials or, chemical peels can be good for that. If you want to do something at home, you can do either an over-the-counter retinoid, so like a Differin gel, or a prescription would be like a tretinoin, but you do have to be careful just with under the mask because it can become irritated. So scrubbing from the top doesn't always work. You have to kind of work its way out from the inside. There you go. All right. Both of you guys.
I was just going to ask a question for hair loss. Do you feel that menopause
causes some of that as well?
Oh, for sure. So when I was saying hormonal, that's definitely menopause. So it just depends on what part of life you're in. So when you're going through menopause, definitely it will affect your hair. So there's the normal aging of us just getting older, but then when you have hormonal changes, it will definitely cause, most people, some level of hair loss. Okay, go ahead.
First, thank you for all that information.
Oh, thank you.
What office do you mainly work out of?
So I work, so right now I'm working 2 days out of our West Boca office, which is off of 441 right next to the West Boca Medical Center. And then I'm working 1 day per week at Central Boca, which is off of Palmetto Park and Power Line. Yes. So.
Are you familiar with a fractal laser?
I am. We do not have that one, but we have another laser that's called BBL, which has it's a resurfacing, just not quite as deep.
So the fractal is deeper?
In general, yes, but the BBL has has very good results. It depends on what you're looking for.
Well, the reason I asked, I've done 4 sessions of the fractal,
Oh,
and I did it basically for a scar that I wanted a filler for, but she said she wouldn't because it would go in more. And how long does it take to really see the results of that?
so I will say I personally don't use the Fraxel laser. I have in the past, so I couldn't say specifically. It depends on the depth of a scar and what settings they use. So it depends. It's by the person and it's also by the operator and the machine. So it's tough to say, but you could talk to one of our physicians that does do the other laser. It's still a very good laser, and you can talk to them about it and see if that's something. Or microneedling, it's a little bit not as deep, but it might work for you in a different way.
Okay. And I should stay out of the sun for how long? 3 weeks?
After doing it, I would say yes, because it's any kind of trauma to the skin. You don't want to get like a darkening of the skin too. So I would say it's always safe to be a little more on the cautious side when you're healing.
Thank you.
Sure. Okay. Anyone else? Yes.
How often would you recommend using those cleansing grains on your skin?
Say that again, the cleansing grains?
Yeah, scrubs.
It depends. I would say it probably depends on the scrub that you're using. Some scrubs you can use every day in the shower. It just depends on what's in it.
It shouldn't be very harsh, correct?
Right. I would use something that's very mild. I'm sorry. I hope you guys could hear me, and it was hard for me to see here, so I had to look up here. But any other questions?
You brought up hair loss. As I'm getting older, besides the hair
Oh.
loss up here, there's hair growth into, right?
Yes.
So that's hormonal, I would assume? That's,
Yes.
sorry,
Yes.
gotta bring it up.
Yes. Yes. So unfortunately, yes. But there is,
There's nothing you could do about it.
well, you can do hair laser removal. So that can. Now I will say it really only works on dark hair. So if it's like the baby white hairs, it's not going to work, unfortunately. But it does work very, very well for dark hair. Yes.
You also said you did not recommend using cortisone on the face.
For when you have a peri-oral dermatitis. So right now I try to avoid it for most things just because it can cause other problems. So you might be using it for like if you have a little eczema, but you may induce a peri-oral dermatitis. So if you don't need it, I wouldn't use it. But if we tell you to use it, then use it. Because we'll rock the boat a little. All right. Thank you so much. Oh, yes, please.
So for psoriasis, what is the best treatment for psoriasis?
Oh, boy. So that's a big question. I would say it depends on so many things. It depends on how much of the body is affected, what parts of the body are affected, if you've got joint issues, the age of the patient.
Hand and feet.
Hand and feet. So if you've got palmoplantar psoriasis, there's different things you can do. So there's a lot of biologics that are out right now that actually are very helpful in general for psoriasis. But it depends. So there's also some non-biologics that can be very helpful. But it depends on if you're a woman of childbearing age and different things that we would try different medications. Sometimes you can do just topicals, but with the hands and feet, it's really difficult. You're welcome.
All right.
Any other questions? Oh,
Thank
thank
you
you.
very much. All right, so we learned a lot. We absolutely learned a lot. That was really interesting, and it didn't. It's not just for women. I mean, we do have a gentleman in the room. Anyway, thank you all for coming, and I will see you the next time on Zoom or in person.